Okay. Very good afternoon, everybody. I know this is lunchtime, but what we are going to talk is very important. So, whoever is there, we hope to give some valuable practical points. The session before this, last session, was on medico legal cases. There were many discussions on endophthalmitis and cluster endophthalmitis. So, this is something which we have to be careful. One case of endophthalmitis will be enough to create a nightmare in our minds. But imagine having a cluster endophthalmitis, it is going to be a major problem for rest of our lives. It is not going to go off the mind. But today we are in a position to manage cluster, and we are also in a position to prevent a cluster. So with this in background, so I thank Dr. Rajiv and Dr. Sashikumar sir, two seniors. We are all passionate about infection control, and I hope we hope to give you some valuable points. So if you see here, these are the things that can happen now. There are so many things that are being done for infection control, like various protocols. We have, unidirectional flow in the theatre. We have double doors in the theatre. All the new OTs are well equipped to prevent infection occurring. Starting from the era of amphitheatres, now we have moved on to eye theatres, which are very highly sophisticated, and operation theatre is the heart of the eye hospital. Now, if you look at it, the NABH gives some guidelines, and there are standard guidelines for operation theatre. It should be in the floor at the top where there is minimal traffic and so on and so forth. So there is something called super specialty OT and general OT. But general OT is under which the IOTs come. It is not like a super specialty OT. So there are three types of single theatre. Many of us will have twin theatre suites are there, and OT complexes with many OTs, except very big hospitals. So we come under general OT. Now this is very important to zone the theatre, because we do not want crossover of used and sterilized items. That is why we categorize them into at least sterile, semi-sterile and non-sterile zones. So ideally it is divided into a protective zone, a clean zone, an aseptic zone and a disposal zone. So now what do we mean by all this? We have markings also. It could be red, yellow, and the green would be the most sterile area. The protective zone will be an area where we enter, change rooms and store rooms and all. The clean zone would be a corridor, transfer rooms and patient recovery area and so on. The most important is the aseptic, which will be the part of the CSSD and the operating room. So now we have a disposal corridor, like how I showed you. There is something where there will not be a crossover between the sterile and the unsterile. So what are we seeing here? We are seeing one which is coming up just like that, and a one. So manually constructed OT versus modular OT. Modular OT is there. There are many advantages, but it is not mandatory. It is not at all mandatory. A regular OT is as good as a modular OT, but a modular OT can be customized, maintenance, and it is a long-term prospect for any hospital. The heart of the theatre is the CSSD. So you all understand now the CSSD can be done even in a small single theatre complex or a multi-theatre complex. There are three zones. One will be where you receive the soiled zone, used items, then there will be a barrier, then it comes to the cleaning zone where you clean it. You have where you receive the soiled items or the used things, you can do all the inspections, take off all the unwanted things. Cleaning zone will be, there are various steps which Dr. Rajiv will show. Once it is cleaned and packed, then it goes into the sterile zone where the CSSD, your autoclave will be there. So between the clean zone and the sterile zone, ideal to have an autoclave, which is a double door autoclave. One side you put in the packed items, the other side you get the sterilized item and put it in the storage area. This is the best way to construct an OT. This is the unidirectional flow, and this is not acceptable at all in the newer CSSDs, or even the older CSSDs can be modified. So this is where we get everything, clean it. You can do it manually, automated, check for patency, all the broken things can be taken. Then you have the packing. After cleaning, packing, you do the packing there. There are number of ways of packing, not like the older ways of, even still we do this bin packing, but there are specific packings for each set which Rajiv will show. The sterilization area is a CSSD. We can have a double door autoclave, ethylene ETOs and plasma sterilizer. Then again, the storage area should not be close to the wall, should not be close to the floor or the roof. The temperature should be 24 and all the needs are there. Your validity will depend on the type of sterilization. So from the floor it should not be touching, near the ceiling it should not be there, no cardboard boxes, make sure there are no insects anywhere. Now coming to a word about surveillance, which I need to cover at the last, but after my talk and Dr. Shashikumar's talk, it will be Rajiv all the way with his videos. So we need to, when you talk about surveillance, you have to take care of the surfaces, air and water. These are the three important things. Though there is no need for swab at this point in time, that National Program for Control of Blindness would say you will need to take swabs at least once in 2 weeks. The settle plates are for the air. You can keep it in at least 5 places away from the wall at a height of about 1 meter above the ground, 1 meter from the wall, exposed for half an hour or 1 hour, whichever is the protocol. And then you have the reports. It has to be done periodically. Sometimes what happens, the hospital does it, they get the reports and file it. Then when they get an end off, they will realize there was an abnormal count. When you have a HEPA filter, it should filter 0.3 microns at the rate of 99.7% efficiency. So these reports need to be done once a year or once in 6 months, depending on the usage of the hospital. The air sampling can be taken, ideally we all take the settle plate methods. Water, we need to test it physically daily. Chemical testing at least once in 6 months. Microbiology testing, ideally once a month would be good, and RO water again should be tested every month. So this endotoxin level is something which is important. You have to give it out and test it. Microbiological surveillance will also include E. coli. You know, this counts, you cannot get 0, but you have a low risk water. Now these are the reports we collect periodically, and the chemical analysis we get to make sure that the water is good. The endotoxin level should be within acceptable limits. Recently we had maybe a few months back cluster of TAS, and we found that endotoxin was very high in some kind of IOLs. The AOS has formed an adverse committee, registry. So there is a committee for this with a mixture of all sorts of microbiologists, even a legal expert. If there are any problems, it could be a task or it could be endophthalmitis, which is a cluster, you can report. The AOS team will support you, and maybe if necessary they will also give a legal support. In Tamil Nadu, under our President Dr. Nirmal, we have a Quality and Infection Control Committee where our dear Rajiv is also one of the advisors. So we do 4 programs at least a year, and we also help people who needs. So this is in gross about the zoning of OT and surveillance. Now I hand over to Dr. Shashikumar sir for his next talk.
Good afternoon everybody. I will be dealing with the type of sterilization techniques that are available. Sterilization, it's a complete elimination of destruction of all forms of microbial life and can be accomplished by many methods. It is mentioned as the sterility assurance level, which is 10⁻⁻⁶, that is 1 in 1 million spore can survive after the sterilization process. And sterilization, if you categorize the microbial spores and the microbes in the descending order of resistance, bacterial spores come right at the top, where it is very difficult to eliminate them. That can be eliminated only by a sterilization process and not by a disinfection process. The various types of sterilization that is available are heat sterilization and the chemical sterilization, and then the gas and the ionizing. In the heat, the dry heat is usually used in laboratories, and mostly we use the moist heat. Boiling is not recommended, and steam under pressure or autoclaving is the best method of and the cheapest method of sterilization in ophthalmology. Chemical sterilization is not at all advisable in ophthalmology. Gas sterilization, ETO is widely used. Gas plasma is more effective, but it's very costly. Both are low temperature sterilization processes. Ionizing sterilization, ionizing radiations using radioactive isotopes and X-rays are also useful, but cannot be done in the hospital setup. Boiling, it has got only theoretical interest and should never be used as an alternative to accepted methods of sterilization. Steaming also, pressure cooker was once considered in many hospitals, but it cannot be a substitute to autoclave for multiple reasons. Autoclaving is the best method, steam sterilization under pressure. Here the steam which can be used for 121 degrees centigrade for 15 minutes or 134 degrees centigrade for 3 to 5 minutes can be used for effective steam sterilization. Here you should understand that there are certain elements which should be fulfilled before doing the sterilization. That is cleaning, disinfection, packing, loading, all those techniques should be proper, then only your sterilization will work. Otherwise, what happens is that 1 in 1 million spores can survive after your sterilization process. If the instrument contains about 10 million, then at least 10 spores will survive. That can cause havoc in your surgical outcome. Quality of sterilization, air is the most important obstacle for steam penetration. So you will have to remove the air from the autoclave. And instrument packs must be suitably arranged to ensure effective steam penetration. All hinged instruments should be opened and disassembled. Porous and lumen instruments require special care, and neutral detergents should be used while cleaning. Narrow lumen or cannulas, that requires special attention. And long tubing, especially the phaco tubing, vitrectomy tubing, all that also requires special attention. And ultrasonic cleaners are recommended for efficient cleaning in narrow lumen cannulas and serrated instruments. Steam quality is very important in steam sterilization. We all have seen, when we boil water, we can see steam. That is a wet steam. Wet steam is visible because of the aerosols that it contains. Saturated steam contains more energy. It contains 7 times as energy as the water at 100 degrees centigrade. Saturated steam is dry and invisible. And this 7 times energy is transferred onto the items, and that makes it sterile. Steam, if the steam is too wet or too dry, 100% dry steam also is not suitable. Steam should be less than, it contains less than 3% moisture. Here the temperature, the saturation of the steam and time of exposure is very important in an autoclave. There are several types of autoclave, the gravity and the pre-vacuum. There are 4 cycles of sterilization. First is the preconditioning, where the air is removed. It can be removed by gravity or by vacuum. We will come to that later. And the second phase, the steam is, the building up of pressure and steam occurs. And in the third phase is the kill time, where the pressure and the temperature is maintained to kill the spores. And in the fourth phase, there is a post conditioning, where the pressure is slowly released and drying occurs. In a vacuum assisted cycle, the phase 1 is the preconditioning, where the air is removed by gravity or through repeated serial pressure and vacuum pulses. Once a vacuum is created, steam is let in to build up pressure in the second phase. And the third phase, as I said, is the kill time, where the actual destruction of the microbes and spores take place. And the fourth phase, the post conditioning, where the exhaust and the drying phase occurs. What are the types of autoclaves that are available? One is the vertical and the horizontal, and also the gravity and the vacuum type of autoclave. Vertical autoclave, the steam is never dry, because there is only a common chamber for steam generation and for the kill time. This doesn't have any role in sterilization of surgical instruments, and is at best maybe good to disinfect contaminated items. Horizontal autoclave, there is a separate chamber to produce saturated steam, and that is the best. And vertical autoclave, it just has got some gauges and cannot be used for sterilizing our surgical instruments. In a gravity cycle, because the steam is lighter than air, it is injected in the upper part. This displaces the air down through gravity, and further steam injection can facilitate its passage freely through the items. While in a vacuum assisted cycle, a separate vacuum pump is used to draw in or suck out the air, and then the steam is let in, which sterilizes the objects or the items that is placed inside. What are the classes of autoclaves that we have heard that there are 3 classes of autoclaves. One is the N class and the B class and a class S in between. It is easy to remember. Class N is the normal autoclave. It doesn't have any vacuum pump. It is a small and can be used as an auxiliary unit. While class B is the best, that contains fractionated pre-vacuum and can sterilize all loads, including packed loads and the porous loads. Class S is between the N and the B class. It has a vacuum pump, but it is not a fractionated pre-vacuum. It is only a single stage pre-vacuum and is less effective than the B type. So whenever you go for a autoclave, you always go for the class B autoclave. The autoclave cycles, there are essentially 3 autoclave cycles. One is the gravity cycle, which is the most basic sterilization cycle where the steam displaces the air. In the vacuum cycle, a series of vacuum and pressure pulses are used to suck out the air, and then steam is let in. While in the liquid cycle, it is essentially used in laboratories to sterilize media and all. It is a gravity cycle with a slower exhaust rate. Otherwise, if the exhaust rate is faster, the fluids will boil over. And the flash cycles are seen in healthcare setup where high temperature cycle for a slower period of time is used. And the common products sterilized in autoclaves and the gravity method, as I said, it is mainly the biohazardous waste and the unwrapped goods. While in vacuum, you can sterilize all sorts of heat-sensitive, heat-resistant equipments like wrapped loads, porous materials, and pre-packaged goods. Liquid method is used in laboratories. When you load the autoclave, the flat packs should be kept vertically. Large packs should not touch each other. Small packs can be kept on top, and the basins and all other things should be kept vertical. Loading technique is mentioned here, and class 5 integrators or class 6 emulator strips should be used in every pack. Steam is non-toxic, economical, and can be used for heat and moisture stable devices. It is unsuitable for an increasing number of heat and moisture sensitive devices and sharp instruments. It can promote stains or corrosion. Formalin chamber is not at all advisable in ophthalmology. It is very difficult to validate, and it is irritant and toxic. Ethylene oxide is good for heat sensitive items. It is highly inflammable and toxic, and it should be used with care. The item should be dry, otherwise if there is moisture it can produce toxic substances, and the devices should be aerated before using, so it takes time. But it does not corrode instrument, it is a low temperature process. Gas plasma is a safer alternative. It creates an electromagnetic field to break the hydrogen peroxide vapor to produce free radicals and UV light which can sterilize products. But it is costly. It cannot sterilize materials like linen, wood, powders and liquids. The material compatibility for steam, cloth paper and SDPE can be used, while gas plasma only the SDP or a polypropylene, polyethylene material packs can be used. Ionizing radiations, it is a low temperature method, but it cannot be used in hospital setting. The disadvantages are the increased capital cost and requires handling and disposal of radioactive materials. And shelf life, if it is properly stored with in the room of less than 26 degrees centigrade and a relative humidity of 30 to 60 degree, paper packets can last 30 days, muslin packs can last 21 days, plastic bags can last 6 months, and seal pouches can last 12 months. So to conclude, steam under pressure is the cheapest and the best autoclave technique. Always go for a class B autoclave with a fractionated vacuum pump. ETO and gas plasma are excellent methods for heat sensitive items, and do not depend on vertical autoclaves and formalin chambers. Thank you.
Good afternoon, everybody. I've got 3 topics to cover. I'll go one by one. First is the hand hygiene. With the COVID coming into play, that we all learned about hand hygiene. But here what I'm going to show is why we do certain steps. And this is the post-op endophthalmitis. Definitely we don't want to see like this. So hand hygiene is very important. This is the culture from a relatively free hand, clean hand. It looks like this. So hand hygiene is very, very important. And a simple hand wash like this is not enough. So we need to follow all the steps described by the European norm 1500. These are the steps what we need to follow. And this is palm to palm on the dorsal surface, ventral surface, tip of the finger, knuckle, thumb, and the wrist. Of course, the arm is also covered, but why we need to do these steps is being explained here using watercolor. See, when we rub using watercolor, this is not following the steps, what is described. If you look at carefully, the web space are not covered at all, which is very dangerous, where the prominent thumb is not covered, the entire web space is not covered. So if we follow all the steps described in European norm, see what's going to happen now. This is being demonstrated by Shashikumar sir. It took 2 days for him to wash it away after this. See, not a bit of a space is covered in this. I had been showing this video for past 10 years, and some people came with a query that this is using watercolor. What we are using povidone iodine, which is a liquid which will spread everywhere, it will clear. So I came up with a new idea. I put watercolor within the web space and did the usual hand wash. What we do, we followed all the steps. Initially not covering the web space. And we washed, just like what we do before we have our meals or anything, just like that. So look at that, the watercolor is still there. So if you follow the steps, all the steps, what is described in European norm, you can see that at the end of it, the web space is clean. So it is important that you follow all the steps described in there. This is the proper way of doing it. I'm not going to cover, you all know about it. I'll skip on to the next important thing. Once you do your hand wash, it has to be dried before you wear your glove or the apron, whatever it is. This is the wrong way of doing it. This is just drying the palm alone. So the proper way of doing it is using the 4-quadrant technique. I'll show you. This is the 4-quadrant technique. One quadrant is used for one hand. The second quadrant is used for the second hand. The third quadrant for one arm. And the fourth quadrant, the other arm. This is the proper way of wiping. Then gloving. Once you have your gown, surgical gown on, there are different ways of wearing your glove. This is the standard way we follow. How you touch the inner surface with the left hand, and without touching the outer surface of the glove, we wear the. While wearing the second glove, touch the outer side, and without touching the inner side. This is the standard way of wearing. And wash away any talc powder or whatever it is powder before you do your. But what is recommended now is the powder free gloves, which is the nitrile gloves, which is recommended for the ophthalmic practice. This is the way of using the nitrile glove. The same method. we follow. And that's the way it is done. The other ways we do is the assisted way. The scrub nurse holds the glove for you and you introduce your hand into it and without that. This is the yet another way of wearing the glove. This is very safe for the surgeon, and this is the best way of no touch technique. You cover your hand with the gown itself, and with the covered hand you hold the glove and wear it. This is the proper way of gloving. And once you're gloved, make sure that you don't make any mistake. Look at that. The drape is there and you're holding it underneath the table. It's very dangerous. And this, I'll just quickly go through this. We are using a lot of this disposable glove in our OPD. We just take like that, casually use it, thinking that it's going to protect us. It's neither going to protect you nor the patient by wearing a glove like this. So this is the way we normally do it. Now we are doing a procedure. Suppose there are some organism, maybe bacteria or virus, which is demonstrated here as green paint. See? And that what really happens is you're going to contaminate the glove. See, already that paint has come on the outer surface of the glove. So it's not going to protect you at all. So what you have to do is do hand hygiene, then take the glove and use it. Without a hand hygiene, this method, wearing a glove, is not going to protect you or the patient. Okay. So the best way is to follow you do a hand hygiene and then take the clean glove and do the procedure. Okay, thank you. That's hand hygiene. Next. Instrument cleaning and packing is very, very important. So the first thing, it starts right in the theater immediately after the surgery. You segregate it and flush all the luminous instruments, clean them, wipe them just immediately after the theater and dispose of whatever is needed. So the cleaning and packing starts right in the theater immediately after the theater. And the best method of doing it is the 3-bucket technique. Once you got it, you have distilled water or RO water in 3 trays, and in the first tray you can add a mild disinfectant. Now it's commercially available as InstruClean from Oral Lab. Just add that in it, soak the instrument in the first tray with the disinfectant and clean it within the solution, and don't do it outside the, I'll show you now. Now just soak them instrument for a few minutes there and be very gentle. This is what I was talking about, InstruClean, which is available with the Oral Lab. It is nothing but cetrimide, which is commercially available as Savalon. You can use that. Dilute it and use it. So after you soak it, use soft toothbrush. And this is the wrong way of doing it. No, don't do it outside the solution, because it's going to produce aerosolization, which is dangerous. So it looks neat, but this is not the proper way of doing it. This is not the proper way of doing it. So when you do like that, see that aerosolization, you're going to contaminate the entire area. So the ideal way of doing it is clean it within the solution. That's the proper way of cleaning. And once you have done it in the first tray, do this, repeat the same thing in the second and the third tray before you send it for drying. And autoclave ultrasonic cleaning is a good procedure, but please avoid the enzymatic cleaner because it's reported that the incidence of TARS is more with enzymatic cleaning. This is not advisable now. So, ultrasonic cleaner with heater is also available, which is this is the smaller version of it, where you can use small cannulas and things. And this is the indicator for it. It turns blue, turns red once you dip it in the ultrasonic cleaner, indicating that the adequate amount of ultrasonic energy is dispersed in the cleaner. And coming to the cleaning of the phaco handpiece, usually what we do is like this. Just aspirate like this and put it. Is it correct? No, this is not the proper way of cleaning your handpiece. The best way is unidirectional. If you are sucking, only suck. Don't push again. This is the, it should be, the flow should be in the direction of the flow as you do surgery. In phaco handpiece, the nucleus piece is sucked in the direction. The other one is infusion is through. So this is the proper way of, this is the proper way of the cleaning the irrigation port. So be very careful while doing your, about 200 ml of your solution should be injected, that is distilled water should be injected to clean the handpiece. Better to avoid RO water for cleaning your, same thing applies to your irrigation aspiration cannula also. This is the, for aspiration, you aspirate the cannula instead of pushing. Normally we do this is wrong actually, you have to aspirate only. We think that when we push it out, we are going to push out all the dirt within it, or the nucleus matter or the cortical matter which is inside. But this is the way to do it. This is the proper way of doing. The same thing applies to Simcoe cannula also. It should be unidirectional, the same way as the fluid flows through it. And improper technique, see, is cleaning his instrument outside a toilet. That's not a safe place for you to clean your. And what is wrong here? They are packing it without drying. Always the instruments should be dried before sending for autoclave. And wipe clean with lint-free cloth. Don't use this ordinary gauze or anything which will leave fibers, cotton fibers on it. Now it is commercially available as lint-free cloth. It's available in the Amazon. It's used for cleaning. And pressure pumps are very good. Air pumps are very good to dry luminous instruments like this. It's commercially available for it's called the blowers, or just dry it like this before you send it for autoclave. You can even use hair dryer and check all the instrument under the microscope before you send. Check for patency once it is dry, and look for the sharpness or edge. Use of silicone cap sleeves like this is very good. It will protect your instrument. And pack it in serrated boxes like this, and include indicators in each set. Pouch is the best way of packing it, and these are the instruments. Now, these are the different packing methods for your instruments. This is called the envelope, parcel method, wherein you fold and repeat the fold backwards. Every time you fold, keep a fold outside. That's the way of doing it. This is the parcel way of packing. It is meant for the theatre staff to start the theatre initially. Just remove it, put it on the table, on the tray, and then open and start the theatre. That's the way of doing it. Yet another method is the envelope method. It looks like an envelope. Here again, leave a flap for all the fold you make. That's the way to pack fold. This method is used for introducing a set to the surgical site. You hold it and hand over a set to the surgical staff using this method. So, you open up like that, hold the flap without touching the inner instruments what you are going to hand over, and then you hand over to this. This is called the envelope method. Now, most of us are changed to disposable gowns, but if we are still using the older method, especially the government hospitals, we use this reusable cloth gown for surgical gowns. But look at the way he is folding. It looks very nice, everything. This is in a gynec hospital which I recorded, and the anesthetist has come. He is opening up and seeing, he doesn't know which is the head or the tail of the gown, and trying to open it, the front, back, everything is confusing. Ultimately, he has contaminated the entire thing with his wet hand. So, he is wearing. There is a proper way of folding the gown, surgical gown. Say, look at this. This is the way it has to be folded. So, you spread it around, fold it into half, fold the back portion into half again. Hope you understand what is being done. The arm is part is kept in front, and it is folded into half, and it looks like this. The back flap is folded halfway. The entire thing is folded again into 3, and the center portion is lifted up in a W-like fashion and folded into 4 layers. Ultimately, what happens is the shoulder part comes on either side. This you can tie it up and send it for autoclave or ETO sterilization, whatever you are doing. The same method can be used for reusable, disposable also, if you are using it for the second time also, if it is not too contaminated. So, the advantage is when you remove from the bin, just all what you have to do is just introduce your hand like that and just open it up. It opens up. So, this is one of the best way of folding a gown. Thank you. We will go to the last topic. After that, we will have a few minutes for discussion. No, I am continuing. 1, 10. I'll continue with this. Same thing, validation. Yeah, the same thing what you have opened. So when it comes to validation, as far as sterilization is concerned, the machine is very important. You have to standardize the machine and check that your machine is working well. The vacuum part is very important, the temperature and the TST, that is temperature, saturation and the time. And we have different indicators. The best one is the biological indicator. Then I showed you the ultrasonic cleaner and documentation. Above all, you will have to review your performance and the entire process periodically. So the indicators are classified into class 1 to class 6. We use the class 1, class 2, 3, 4 is usually used in industrial purposes like in chocolate factory, food factories and all. 5 and 6 again we use. I'll tell you. This is class 1. Class 1, what does it say? That particular set has gone into autoclave and come out, or autoclave or sterilization is good. It doesn't say whether it is perfect or not. So it is usually used to stick on top of the pack like this. Okay? So that is class 1. Class 2 is Bovedic. How Bovedic is done is, the Bovedic sheet is kept between sheets like this, packed like that, and in an empty load. No other load should be there, only these packs should be done. It is usually done immediately before the sterilization happens. And the color change should be uniform like this and documented to prove that your autoclave machine is working. And these are the different models and designs which is available commercially. And these things. And class 6 indicator can be used in the helix tube. This is helix tube is to check the vacuum of your autoclave. This is a tube which is about 1.5 meters long with 1.5 diameter inner lumen. The indicator is placed in the end of it and it's sealed airtight. And this is placed in between the load what you are doing and checked for autoclaving. This will tell you whether the machine has got good vacuum cycle. So once it is ready, you check the class 1 is checked, the helix tube is taken out and check for the indicator. This is the class 5 indicator which I will be showing you again. This is the helix tube indicator. And if there is leak or the vacuum is not clear, the color remains pink. Okay. And this is the best helix tube available commercially, which is made of metal. It's got a long tube, as I told you. That part of it is silicone, and the airtight component in this is because of there is a seal there. A rubber seal is there which will give you. This is what is recommended, but the plastic ones are also available. And what I am showing here is a batch of 10 helix tube. These tubes are used to standardize your autoclave. This is not done by you, but by the company when they come to install. This 10 helix tube are of different size and calibers. All the 10 has to pass the test if your autoclave is good. And this is called the process challenging device. This is cut open to show you that how it looks inside. Actually, it will be fully covered. You will not be able to see these tubes and all like what you see in the green part. The open part is this one. This different color is for different specialty. The yellow is for the dental, the white is for general surgery, green is for ophthalmology, because the length of the inner tube, that steel tube, is different. So it helps us to, this again tells us the vacuum cycle in the autoclave. And you can use biological indicator also in process challenging device, PCD it is called. Okay. And this is class 5. The disadvantage with this is, see, it says pass, fail. And if the black passes in between, pass partially, we still say it is passed. But class 6 is, it abruptly changes from yellow to blue once the autoclave process is over. So class 6 is little better than this is a dual indicator, whether your sterilization occurred is within 3 minutes or 10 minutes. So it's a dual thing. These are the different class 6 emulators available in the market, and the color change also is. Now I'll show you how to place an indicator in the set. That is class 5 within the instrument tray, along with the instruments. Seal it. Biological indicators is the best for checking your sterilization. Contains 1 million spores within it, and there are different biological indicator for steam as well as the ETO sterilization. Now this is the way it is done. It is kept within the batch along with a cloth like this. Once it's ready, you remove it. Along with that, you have a standard which is not used in the autoclave to compare your autoclave now. Then break it. There will be an ampule-like thing within the thing, that is the broth used, and incubate for 48 hours to see if there is color change in it. There are quick readers which are available now, which will get the result within 3 to 4 hours. And have any of you seen what is really inside a biological indicator? It's got a cap with a hole for the steam to penetrate, and there will be a filter, paper filter, to filter any other bacteria or spores entering the biological indicator. And the broth is there, which we use for the spores to generate if it is live. This is the broth within it, and ultimately this is that small disc what you see is the 1 million spores. Okay, that is the indicator. Then different spores are used for different sterilization. This I had already shown you. And steam and formaldehyde should not be used in ophthalmic practice. There are indicators for it. Definitely Cydex should not be used for ophthalmic use. For ETO we have different sterilization indicators. One is the biological, which I had shown already. For plasma sterilization, the indicators, there again the biological indicators can be used. This is the plasma, and these are the indicators for it. Thank you very much for your patient listening.